Welcome to this week's episode of Marijuana Mind with yours truly, J Dog Davis, and my positively Fukushima-like co-host, Cynthia Brewer.
I feel like you have never left. You never left Japan. Like you could take the boy out of Japan, but you
I was
can't
going to,
take the
what,
Japan.
I debated between Fukushima and Chernobyl, but
I'd
Fukushima
go
just
for
sounds so much cooler.
yeah, either one. Explosive, radioactive, harmful.
Exactly.
Yeah,
That's
I
you.
get it. Yeah, I
Explosive and
think
radioactive.
well,
Toxic and yet necessary for life simultaneously.
toxic and extra. I love all of this. This is like me to a T, and I'm not even a little bit offended. I feel like you know me so well.
It would be hard to offend you.
Actually, yeah, that's true. That's true. We won't get into that and all the ways she can offend Cynthia. Today we have an extra special guest, someone that I am blessed to work very closely with. Stephen Goldman is the CSO or Chief Scientific Officer of Kaycha Labs out of Denver, Colorado. He is University of Kansas, and we'll talk about that in a second. Graduate with a master's in science and a bachelor's in chemical and biochem engineering from the University of Iowa. Now, the reason I said that is because my mom went to K-State, so I have to,
I
by
didn't
law, hate you. I didn't know that you went to University of Kansas, but Stephen has spent the past 13 years studying and working in the lab space, but focusing primarily on cannabis since 2015. His dedication to the research of the plant health was recognized by Analytical Scientist magazine with the 2021 Innovation Award for the MH Verify HLVD kits that he has come up with. I know it's actually a big deal. The judges were actually quoted as stating this technology could benefit the economics of the cannabis and hemp industry nationwide and around and worldwide. I don't know why that doesn't make any sense, but pretty big deal.
We're going to
Stephen
talk more
Goldman
about
is
that, right?
helping.
Because that's
We have a few things to talk about because he's going to announce some new exciting stuff that by the time the podcast comes out and is aired, we should be on our P's and Q's and be delivering those press releases. But welcome to the show, Stephen. We're really excited to have you.
Thank you. Yeah, nice to be here and hear all about your nuclear tendencies.
I would say, actually, I liked the nuclear tendencies. So, first off, why'd you pick University of Kansas and not K-State?
You know, ag schools have kind of different focuses than the others, right? So I grew up in Iowa and did not choose the ag school there either. I passed on Iowa State, even though that's where I lived at the time and went to the University of Iowa for their biochem engineering program. So definitely, you know, the geek track. I chose the program, not the school.
Okay, so you
but you
like
you
being
wanted to stay in the Midwest, clearly.
Yeah, at that time. Nowadays, that's definitely changed. I don't spend a lot of time in the Midwest. But yeah, back in those days, I was very happy there.
well, you obviously spent a good amount of time on your education in the field of chemical, biochemical engineering, science, and lab space, obviously, for the first part of your work career. What made you decide to go into the cannabis space from where you were?
Yeah, that's an interesting question, right? Because I spent some time in the biotech industry and then the pharmaceutical industry, right about
Mm-hmm.
right before I pivoted to the cannabis testing lab here in Denver. I was in Colorado at the time, working for a pharmaceutical company, and said pharmaceutical company got a $4 billion fine for bribing doctors in China. You guys probably remember that.
I
Um,
do actually.
right,
That's that's interesting. So you worked there during that, and anyone who doesn't know, they can just Google it.
right.
So
And so, you know, it's a little bit, it's easy to get jaded in that environment, right? And along came, you know, through my network, an opportunity at a cannabis testing lab. And, you know, I didn't have a rich background in cannabis at the time. So, you know, very interesting to me. I think, you know, what I know now is the impact that we have on public health is far greater than it could have been, right, in the pharmaceutical industry at the time. So, you know, I made that jump mostly out of interest, but you know, very pleased with the decision.
yeah, so you've been um, running Phytotech, which is based in Denver, Colorado. It's part of the network of Kaicha Labs since 2015. So I think if I'm correct, you're probably the only employee that has the most experience, as much experience as anyone else. Like 2015 it seems like dog years in cannabis. He's like a veteran if it starts in 2015, 2014, that type of time.
It's the only industry when you're the OG, when you're 8 years in, right?
Yes.
So definitely feel old.
But no, this is actually a big deal though, because your attention has been spent on research for this plant, but not just like from the lab perspective, because we're not in the sexiest side of the cannabis space. We know that, we're not just printing money and just like partying and all this stuff. It's the lab. We know we do testing well, but you have dedicated a large amount of your time to researching how we can help the people that we have to give the unfavorable news to. And part of that was the HLVD kits that we were speaking about. Tell Justin, because I know, but do Dr. Davis a favor and our listeners, tell us what HLVD and the MH Verify kit
Because
was
I'm sure
about.
that the VD here does not stand for venereal disease.
No, for the first time, Justin, in your world, it does not. Sorry. Pausing.
That's
We,
so personal.
yeah, that's your brain went right there really quickly, right?
Oh, you don't listen to the show, so I got one zing in. He'll be right behind me.
Okay. We spent a lot of time since 2015, right, asking, what could go wrong for our clients, right? And we started looking at a nutrient assay, right? Calcium, magnesium, sulfur, NPK, where are their nutrient deficiencies? So built out that line of testing. And industry liked it. And then they were starting to see phenotypes that were sick, and we would run our nutrient assay, and there was no nutrient deficiency, right? Everything looked normal. So what else could go wrong?
And
So we
like,
started.
let me just clarify though. What when you say sick or there was problems, like what does that translate to?
So they would phenotypically see a plant that looked sick or distressed. Yields were down, right? Leaves were wilting, some sort of phenotypic visual cue that something was wrong in a cultivation.
Okay.
And so we eliminated, nutrients right away. So then maybe it's a microorganism. So, started doing a lot of sequencing projects where we were, identifying, purifying DNA and identifying all the microorganisms there. Maybe it's a plant pathogen, right, that we weren't aware of. And, in some cases that was the solution, and in others it wasn't. And so if it's not a nutrient deficiency and it's not a plant pathogen or another microorganism, right, making the plant sick, what the hell else could be going on? And that's really when we started to pay attention a lot more to viruses and viroids. So Hops latent viroid is a viroid and not a virus, kind of a smaller size, but really turned out to be important, right? Around the same time as we were asking these questions, a group in California published a case study where they showed HLVD was able to infect cannabis plants and cause kind of the sick phenotype that we were talking about, which would be dudding disease. Since then, there's been a ton of research, right, showing that upwards of 80% of all cultivations in California are contaminated with this, representing probably billions of dollars in losses in yield and potency numbers. And from the lab perspective, that's always the pain point, right? Develop a set of primers and probes so that we can measure a virus, run it on a PCR assay. It takes weeks, it's expensive. We need to pay someone highly trained and really smart to run it, right, back in the micro lab. And so we just thought, is there a better way? And that's kind of where we landed on these lateral flow strips. So the MH Verify test is independent of the lab, which people love, right? Because nobody loves talking to me when they call the lab phone number, right? So we mail a couple reactions straight to their facilities. It's literally as easy as an at-home COVID test. Same lateral flow strips. 1 line negative, 2 lines positive. You'll know if you have Hops latent viroid in less than an hour. So, really beneficial. I think a lot of cultivators like it because it's anonymous, right? They don't broadcast to a lab or regulators if they have an infection or not. So,
and just to kind of build on that, because I totally understand what Steven's saying, but there might be people that don't understand because what you're talking about is a test that can be conducted on site at a cultivation facility, correct? So
Correct.
they are pulling their own samples from the plants that they feel, or they see to be not yielding as high of a potency as they expect, or that traditionally would be present in the
Or
plant,
looks
or
like.
maybe as much quantity or weight that they've been used to. So these gradual declines that we can log in our limb system, Stephen has found that, obviously those types of trends need a test. And then this test is all conducted on site. We provide them with everything. And then the training, obviously, all of the stuff they need to go and play science on site without anyone else getting involved in the results. So that anonymity, I think, was big. But is there other types of viruses and viroids that are not HLVD that are affecting cannabis plants?
Absolutely, absolutely. And this is kind of a field of research that's growing a lot these days. So there are a lot, maybe 7 or 8 are really relevant in Colorado. A couple different variations, on the east or the west coast. Some examples are, the cryptic viruses, sun hemp mosaic virus, curly
Lettuce
beet,
sclerosis.
lettuce sclerosis. Yeah, you're learning the names, right? And
I just want to know how they come up with them, but I like lettuce sclerosis. I remember that one.
right. So I think we started with HLVD because from a commercial perspective, it was the most damning, right? It can really devastate a grow.
And it's
Uh,
common, obviously.
Sorry?
And it must be very common.
Exactly. It's in 80% of cultivations, right? The
And,
rest are not as commercially important. They still are. And time will tell how prevalent they are state to state.
and MH Verify is the name of the test strip that you came up with that specifically tests for HLVD. Is that
Right.
correct?
So MH Verify is the company where we distribute the kits. We have currently a test kit for hop latent viroid. In the future, we'll have a couple more kits specific for some of these other viruses and viroids.
So the highlighting of his innovation award was a portion of like some of the achievements that he's done in the plant health part of the cannabis space. I'm not going to say it has anything to do with the lab because this is Steven, this is his intelligence. He's probably one of the most humble and likable, but also he's the guy that like you can say the lab instruments are down, somebody's on fire, this customer's mad, these problems are happening. He's like, okay, very level-headed, which to me is a very unique and admirable characteristic of anyone, because I am the opposite. But we're going to talk a little bit about why I really wanted to have you come on today, because we have a press release that is coming out, which is actually really big news, not just for us, but for the industry as a whole. So can you talk a little bit about the NIST relationship?
Yeah, this is something that I'm really proud of, right? We'll be the first cannabis company, not just
Not
cannabis testing
cannabis lab.
company, cannabis company in the U.S. to have what's called a CRADA. So that's a Collaborative Research and Development Agreement, CRADA, with NIST, which many of you will know, the National Institute of Standards and Technology. This is the division within the federal government that is responsible for standardizing technologies in all industries, right? So really impactful and an important group. And what this relationship between Kaycha and NIST is going to enable us to do is to really solve a lot of the big problems that we as an individual lab company cannot do ourselves. So a really, really exciting agreement that we're announcing now to the world, but has really been 3 years coming, right? We've been kind of working with NIST for a really long time to get here, so a little bit complex in the background, but we hope to make some impactful changes, not only in the standards that we're buying or the proficiency tests that we run, but what is the difference, technology to technology, lab to lab? Where can we do better? Where can we not do better? We expect it to be very, very impactful.
So, Stephen, one of the things that we've talked a lot about in our show and had guests talking about it, it's been a national problem, for example, is potency testing and the, percentages of THC. And we see that, it's just increasing and increasing at an exponential rate that can't be real. And then we, find out, well, because the companies hire individual labs to test and they're incentivized to rate it higher. And is this something are you talking about that might fix that, for example, where it's standardized and one lab can't sort of fudge the numbers in a different way or adjust their machines where it has to be standardized and you'll know if it's 20% or 25% or 15%, that's really what it's going to be at almost every lab?
Yeah, exactly, right. And this is, such an easy problem to start with. And there are interlab variability can be, due to a lot of factors. Some are nefarious, right? Labs cheat, labs lie. They put their toe on the scale, right, when they're taking a subsample. And obviously those are a little bit easier to catch than some of the other things that labs can do, which are allowed by regulations, but maybe in the gray area, right? And this relationship with NIST is really going to dive down to that gray area, right? I think a lot of state markets and state auditors do a good job of catching the cheaters, right? Because those types of things are really easy to prove when you're there in person. But I'm talking about what's the measurement uncertainty if you use a different technology, right? Near infrared versus HPLC, or LCMS instead of HPLC, just to run a potency test, right? Using a GC versus an HPLC. Those are all allowed in a lot of states, but each technology, has its own advantages and disadvantages. Another huge aspect in my mind, maybe the biggest contributor to measurement uncertainty and interlab variability, is the reference materials themselves, the standards. If I buy from one company or another company that makes standards, I'm well within my rights in terms of what's allowed by the state regulators. All I have to do is make sure they have ISO accreditation. But vendor A can give me something that's 18% different than vendor B. And if I'm a smart lab, I know that I want vendor B, right? Because that enables me to report 40% potency instead of 31%. And the only thing I changed was who my vendor was. So there's not a state regulator in the world that's going to solve that problem, right? Because they can't mandate my business only do business with one vendor over the other, right? Yeah. But that is exactly something that NIST can help us standardize. NIST calls the vendors and they say, why is there so much variability here? And the vendors panic, right? They say, oh my God, the federal government, NIST, we got to do something. Stephen Goldman calls the vendors and, they laugh and they hang up the phone, right? So there's no incentive for them to eliminate the variability in their products as compared to their competitors from Kaycha. But when the federal government puts that hammer down, right, we're going to really see some big impactful changes here. And it's not something that can come from an individual state regulatory office.
But what are some of those specific changes that might be instituted that will cause there to be less variability?
Sure. One, in general, giving some press and some light to the problem will decrease the problem, right? The first time labs do a proficiency test, they automatically get better, right? Because they know where they should be. And I use that example intentionally because it is not currently required for a company that makes reference materials to compare their product to their peers. So if I make something, I can sell it. I don't have to actually compare its quality to anyone else. Now, why does it make sense for a lab to be required to compare their product to their peers, but not the company who's making the standard, right? So a quick and easy thing that, NIST can help us apply some pressure on is you must, participate in a proficiency event if you're making these things. Doesn't it make sense?
CRM provider.
Right. Doesn't it make sense that they should sell an accurate product?
Right.
Right now, there's no mechanism for that.
I've never really thought about that because some markets that labs will operate in, the regulation hasn't really caught up to like activities in that market. So they may not require PTs quite yet, or they might add them on as like, okay, now we're going to start requiring them. But that doesn't necessarily mean that the PTs are going to be done for potency or for this matrix or that matrix, flour versus vape. So
Right.
I do see, I've never thought about the people providing the reference, the CRM, the certified reference material to the labs being vetted by another third party, because everyone says if you get it from an ISO, your PTs are from an ISO accredited provider. Is there an ISO accreditation for CRM providers?
There is. And what's not a part of obtaining that accreditation is comparing your product to anyone else.
It
Wow.
seems like if there was a national standard, it could be as easy as having a control for each variable. And if you know that that control is supposed to be a certain number, you take it to the lab and you say, okay, show me what you get for this. And are they accurate or are they inaccurate?
That's a PT.
Yeah. That's what we're trying to do right now with this relationship with NIST. So, a lot of people don't know that this is a problem, right? And the people that know it's a problem are powerless to do anything about it. But now, for the first time, I think we can do something about it with our relationship with NIST.
There's a lot of patients that complain about the variability between locations on potency, and they judge their purchasing and their opinion of those companies based off of the numbers that they're seeing.
Sure.
So let's talk about future forward facing. What could this mean for the patients or people listening on the to the show that are involved in either an adult use program or a patient medical program? What could they see down the line as this gets implemented?
Sure. So, in general, Stephen Goldman opinion, don't buy any cannabis based on the potency numbers, no matter where you live. That's just not what you should be doing. But, I think all of the things that we're talking about now are going to drive down interlab variability, right? We take away the difference in technology, or at least we measure it, right? We take away the difference in reference materials. We continue to put pressure on labs that are, cheating and shut them down. All of these actions, right, they make potency variants smaller and smaller and smaller. There's no one magic bullet, right? We need to continue to do them all. But eventually, I think this conversation goes away. At the same time, I would love to see people just stop making consumer decisions based on concentration, because
What would you like to see it based on? What would be the best thing?
efficacy. How do you feel after you take it, right? If you're taking it for a medical indication, did it work or did it not work? What's the terpene profile in it, right? What are the flavonoid profiles in it? There are a lot of ways to kind of measure that, and it's a botanical, right? So it has to be a holistic perspective.
But unless you have some kind of concrete scale that kind of pre-measures that for you, as a consumer, you might not have the knowledge to go look up terpene profiles and start comparing them. And even if you do, you have to have enough data points to even be able to do that if you have that level of wherewithal, which probably most people don't have the time or ability to do that. So how would you even predict it without just trial and error?
Yeah, I think that it is trial and error, and some of it is crowdsourcing, right? Like, you have the doctor before your name, right? So I won't ask you, but Cynthia, how much aspirin do you need for various indications? Do you buy aspirin based on its concentration?
No, I actually don't even know how many milligrams are in the Advil. Like I take the Advil minis and I don't know how many milligrams are in there. They're just too many ones for anything. I take 2 of whatever for anything.
You take it because you know that it works. You don't even know what's in it or what the strength is, or how much different the extra strength is from the normal strength. Is that 2x, 10x, 100x? Like we never have purchasing decisions based on this in any other thing except in cannabis, right?
Right. If I asked you for some like Tylenol, you're just going to hand me whatever you think is the proper dose of Tylenol.
Right.
Like you're not going to hand me a jar. You're going to be like, here's 2 or whatever. So I get what you're saying. The other side of it is we are in a space where the marketing of a potency profile is the highlight of the product, not the efficacy. Efficacy of the product. Now, back in the day, and I'm going to bring this up very short, but like there was once a thing called MJ Buddy. And that was like a big focus of ours, collecting that information so that doctors like Justin can pull it, because he knows what his patients, if he's treating someone that suffers from severe non-malignant pain, cancer, AIDS, or HIV, somebody that's got PTSD, maybe they will tell him what's been working, but not unless Justin gives a shit or asks, because there's a lot of doctors out there that are not asking, hey, did it work? So I can take notes, and I can help other people more. But that collective source for depositing that data and those data points is kind of missing out of the market. So all we have are people pushing 55% Bruce banners at $15, which is marketing genius, because $15 is a great deal.
Yeah, I mean, if you can make more money, right, by making something up, can we blame companies for doing that? So a lot of this has to be, consumer pull, right? And there are quality metrics that are not related to the concentration of cannabinoids, right? A lot of research coming out of Colorado is that you can't even tell as a consumer. If you blindly smoke something in the high teens versus 30s, you can't tell the difference,
Yep.
right? But what you can tell the difference from is how it smells, right? Or how it feels. Is it over dried? Is it under dried, right? There are a whole bunch of quality metrics we could, focus a little bit more on, right, to get towards the scales that you're referencing, Dr. Davis, but none of them are concentration of the cannabinoids.
Mhm. We actually had a person on our show that has come up with a scale
Are
called
you really gonna do this again?
yeah,
I can't stand it.
it's
Okay, go ahead.
genius. It's genius.
It's not that genius, because you're still focusing on the potency being in a range.
No, it's not based on potency at all. Or that's a
Okay,
very minor aspect.
okay, right. But okay, he's talking about Ronan McConan, who was on the show, which came up from the Dankness Society, came up with like a color.
International Dankness Unit.
Yeah, I'm international is questionable. The guy's very intelligent. He's smart. He knows what he's doing. But essentially, you would assign yourself based off of what effects that you receive and what you also are looking to achieve in a color coordinated way. I would be an 80-90, which is a red orange color, because I like really hard indicas that are earthy and gaseous and heavy.
There,
Justin was blue.
there's a complex algorithm that
Complex algorithm, my ass.
he rates
Dankness unit.
every kind of whatever, and it's based on testing. He'll assign numbers to a particular cannabis strain or sample. And then there's a range from 1 to 100, and but it's not based on potency. It's just based on, say, like 1 to 10 is going to give you a certain feel, and it's going to, and so you can determine, okay, I really love, sleeping. 80s to 90s work perfect for me. And if everyone is using the same metrics, then you can go into any store, and having never tried a particular strain or heard of it, if they're testing it and they say, oh, this is an 80 to 90 on the scale, boom, that's going to help me sleep.
Or
But
it's going to be color coordinated. But you're talking about having to get multiple MSOs and growers on board.
has
You're
to
going
be
to have to talk
universally
about what
accepted to
this
work.
super secret analytical algorithm is, because there has to be more than just Ronan in there judging the cannabis products, because there has to be a panel, there has to be research, there has to be like people experimenting with different things to come up with it. It can't just be one person's opinion. I get it. You're like his top investor now. Like, I don't know how much you gave him, but I bet it was a great investment.
I have not invested anything.
I love the premise of it, because I feel like potency should be completely removed off of the product altogether. You can leave the terpene profile, but I don't care. I can't tell the difference between a 14 and a 17, but I know I love smoking like Rude Boy OG. And you remember Rude Boy OG, Justin? How would be that name? Okay, so it doesn't matter if it was 10, 14, 11. It had severe, I think, issues with HLVD because they stopped growing it and they had to kill it off. But it doesn't matter, because I loved it. I want all potency to be removed. How likely is that to happen, Stephen?
Not likely, right? Because you need uniform buy-in, and the process has to be transparent. So, who's going to come up with that other than the federal government? And I think we recognize how far away that is.
Yeah, I guess you're right. As far as like federal government contracts go, you said that this is a arrangement, an agreement, not a contract, obviously. But is Is there any other cannabis companies that are kind of working on federal contractual relationships like this?
Well, the DEA contracts with companies to cultivate cannabis, right? So for a long time, the University of Mississippi was the only allowed cultivation for the DEA. They've opened that up, and there are now some, less than 10 licensed cultivators in the United States. So the DEA certainly has a relationship, but obviously that's just to cultivate and distribute the product for research purposes.
Do they list the potency on those?
Sorry?
Do they list the potency on the DEA cultivated cannabis?
They're supposed to, characterize what's in the product prior to distributing it. So it should be interesting, right? Because I think University of Mississippi has traditionally been very low potency, and may not have been hitting the same sort of microbial targets that are required from some state markets. But opening it up a little bit, right? They'll have some variability in the products that are available to researchers for sure. Now, are researchers going to make their decisions based on potency of that product? Likely not, right? So that's already an interruption to how we're validating the other side of the market. But I don't see any sort of one answer coming, right? Unless all states, all companies agree on the same pathway.
So what is the next step now that this news is going to be, the news is released to the public? We want everyone to understand why it's relevant to them and why it's relevant to the industry, but
Sure.
what's the next step for this relationship?
Yeah, it's multifactorial, right? We're gonna start with a couple of different things. I think we'll do kind of a technology comparison in moisture to see why there's such a big, gap in how labs are performing and reporting moisture in the cannabis product. We're going to be doing some pesticide stability studies, right? So if pesticides are in cannabis and hemp, how long does it take for them to degrade, right? Nobody knows that, right?
Like the half-life?
Yeah, exactly. We can't do that research, right? So if I spray it on week 7, I expect 3 months post-harvest, right? How much am I actually smoking in? Basic research like that, right? We can start to actually answer some of these questions. Something that I'm really excited about is NIST actually holds their own proficiency testing event. So it's called the CANA QAP, the CANA CAP. They actually homogenize hemp or cannabis flower, and they send it for free to whoever wants to participate. And so because it's free, they get the most participation of any kind of interlab study that exists, right? I think they have about 200 labs that participate, which is almost, all of them, right, in the United States. So once they get that data back, they also ask questions. They say, well, what instrument did you run it on?
Mm-hmm.
Method did you use? Because of our CRADA, they're going to start asking, well, what standards manufacturer did you buy your standards from, right? So now we can say, all right, across 200 labs, here's the measurement uncertainty. It's this big, and this of it is due to the standards, and this much is due to the instrument, and this much is due to the method. We're actually going to be able to quantify like really important questions like that and start to measure them. And once we know how big they are, then we can start fixing the problem, right? If it's truly this much is from reference manufacturers, let's start to put some pressure on reference manufacturers to do a better job.
Just a question, the current PTs that we do we give them information about the instrument, the method, the CRMs, or anything? Or
Typically,
are we just giving them data?
You put an SOP number, and that's about it, and raw
And
data.
we never get to pull that information though about
Correct.
everyone who was in the study. So
Correct.
if there were like there's the Emerald Scientific, Emerald Awards, you can get the little badges.
Yep.
We did that. We do a variety of PTs, but we never really get to see what the collective results are, do we? Just our
Right.
results if we passed or failed.
Exactly. It's exactly right. And it's anonymized. So this will be so much more powerful. And we ask the right questions in the front, you can answer some really good, get some really good answers on the back end. So a super exciting aspect of it.
Will all of the information that we retain from this arrangement be public?
The arrangement is that we will work towards either white papers, peer-reviewed publications, delivered in conferences. This, we're trying to help more people than just Kaycha.
That's a great statement, and that's a great area to wrap up the podcast. I think it's phenomenal. I'm really proud of the work that you guys have done. Stephen's always been one that's kind of questioned things. He's not just going to be the chief scientific officer and the fire extinguisher, but he's constantly studying. You're always on a project and you're researching and you're trying to look for ways to improve the industry as a whole. What, if you can tell us, what's your next project, or what are you working on right now as far as research goes, now that this has been accomplished?
Yeah, this will keep us busy for sure. But we have a couple of grant projects that we won in expanding the heavy metals that we're looking at and seeing which ones are really, a perceived risk versus a real risk. Obviously, the vapor emissions testing is an ongoing area where we're contributing a lot of work. Just won a new grant for polyaromatic hydrocarbons. So, really toxic things from cigarettes and cigars, right, that we know are a big problem. Are they going to be a problem in cannabis? This research study will help us find out. So we're really paying attention to, trying to answer the question of, is a perceived risk a real risk? And if not, why are we worried about it? Let's move on.
That's really interesting. Did you see the study that was performed about the cannabis users over a certain amount of time having an elevated amount of heavy metals in their system?
Yeah.
Yet they did not record the method of delivery or use.
Right.
That's kind of odd.
Yeah, there's a lot of questions, right? The plant is great at bioremediating soil, right?
Yeah.
A lot of it can come from the hardware based on, different temperature that you inhale it or vape it or combust it, like different things are going to come along. So a lot of questions that need to be answered.
We talked about this with Rich Battenberg, who came on and spoke amazing things about you. He's a big fan of Stephen Goldman, but he was on the show and he was talking about how his product, spending a little extra on the cartridges, just putting that effort in and caring, has actually, might cost him a little bit more, but it has secured his reputation. And I know you guys are on a board or some sort of like collective group of,
and that's sort of like Kaycha as well, right? Like you guys are not always the most popular with the growers because
Right.
you're not just handing out results, but people know that when Kaycha is testing or one of your affiliates, that it's quality.
Right. We're the cheapest insurance policy that they'll ever have. It's expensive to have a product recall, right? Or to be associated with a lawsuit after the fact.
Mm-hmm.
Yeah, and I think in the time that Stephen's been in the industry, even the time I've been in the industry, the things that we've seen, the stuff that we've seen that we can't talk about because obviously we're bound by different privacy and NDAs working in the space. But I don't think he would work this hard if he hasn't seen things that definitely need to be addressed and changed as a whole. So we are incredibly appreciative for you to come on and to share this information with us. I'm very excited about the next step. And it's a big deal because now we're partnered up with the government.
Yeah. For good or bad, here we are.
Yes.
I know your time is super limited, so this is not a question for today, but I'd love to have you back and maybe you could talk a little bit more about HLVD and other viruses and testing and how that impacts us. That's a pretty interesting topic that we didn't really delve into much, and I'd love to hear more about that.
Yeah, absolutely. We can chat about some of the more interesting microorganisms that grow. Get real nerdy.
Cynthia, let's schedule him to come back in the near future because it's an interesting topic.
I will. I'd like to have Ronan and Stephen come on, and then they can kind of fight it out where Stephen can ask him questions about the legitimacy of his data, and then Ronan can quietly, not reply.
Let's do that as a third show. So we'll have you come back on just to talk about cool sciencey things, and then we can have that show. And
yeah, we'll nerd out with some past guests. It'll be great. Well, this is Cynthia Brewer signing off for the Marijuana Mind. Thank you again, Stephen, for joining us. Hope you have a safe flight to Chicago.
Arizona this
That's
weekend.
what I said. Arizona.
Happy New Year, all that. And
all right.
J-Dog Davis.
J-Dog Davis, are you doing that? J Nasty?
Oh, that's you. I need you to say that. I
I
feel like
can't say it. I
shooting my
can't.
own horn if I say it.
No, it's just Dr. Justin Davis is signing off for the week. And we will see you all next week.